Budget interlude. My name is Robert Craig, Executive Director of Citizen Action Wisconsin. I'm going to say a couple very brief things about what this bill is and then hand it over to the bill author and go from there in a series of speakers. But as we know, in the last election, it appeared there was a consensus because both parties said deductibles were too high, premiums were too high for health care, and both promised solutions, moving beyond the Affordable Care Act or repealing it. And as you all know, we're also in the middle of this torturous repeal process where both the House plan and now the Senate plan are under tremendous pressure because they do not follow through on that promise at all. In fact, they dramatically raise premiums and costs, shifting them onto average people. And so U.S. senators throughout the country are hearing an earful over the July 4th recess about this to the extent they're having town hall meetings at all. What we need to understand is that there's a lot the state level can do. So in Wisconsin, there's no reason we can't dramatically reduce co-pays, deductibles, premiums. And so if you look at, this is what Representative Genrich's bill does, if you look at BadgerCare, it's a very popular program, it's very successful. We have everything set up as far as provider networks. As has been proposed in states like Minnesota or Nevada, you could create a buy-in where BadgerCare is both a public option on the Affordable Care Act marketplace and anyone could buy into it at cost. And once you do that, and the Legislative Fiscal Bureau confirms this, it is dramatically cheaper because you are cutting out the health insurance company middlemen and because it's a very efficient program. So the Fiscal Bureau, by the way, presumes in their paper a 15% administrative cost for the state, which is probably quite high. Medicare goes at 3%. But even given that number, which is probably an overestimate, literally it would save in terms of deductibles and premiums an average of 30% in the state of Wisconsin across counties. Now this is for a 40-year-old and it's going to differ by county and by what someone's age is. So I'm giving you a rough estimate, but that's how much cheaper it is in general. So going from costing someone $9,386 a year currently for a silver plan for a 40-year-old to $7,224. And with BadgerCare, buying into BadgerCare, and it would be eligible for the tax credits on the marketplace, either the ones under the Affordable Care Act or the replacement ones under the House or Senate bill. So it'd be even cheaper for anyone under 40% of poverty in the Affordable Care Act and in the House bill, or 350% in the Senate bill. So the main point here is that we can use our democratic government, our democracy, to make healthcare more affordable, accessible, if we'll simply take the right steps. This costs the government in the state of Wisconsin nothing, no extra money, and it is much more efficient and a lot better than private health insurance, and certainly people should have the option, especially as we have big, gargantuan for-profit healthcare corporations like Blue Cross threatening people's coverage and pulling out of the state. They're a small percentage of the market right now, but we shouldn't be held ourselves hostage to that. Everyone should have the choice of BadgerCare in every single county in Wisconsin. This state legislature can do this immediately. It's a very simple bill. And with that, we're going to have a series of speakers. I'm going to start with the author of the bill, Representative Eric Genrich from Green Bay. So thank you very much, Eric.
Well, thanks so much, Robert, for that introduction, and thanks to everyone for coming out today. This is really a bill that was born out of a conversation that I had with Robert and Kevin from Citizen Action, but also with local advocates who are involved with Northeast Wisconsin Organizing Cooperative with Citizen Action. So I'm Eric Genrich, as was said. I'm the state representative for the 90th Assembly District and ranking Democratic member of the Assembly Insurance Committee, which is really why I feel a particular obligation to wade into the ongoing debate about the healthcare access, affordability, and quality issues that we're facing across this country and state. So we're here today to offer a homegrown Wisconsin solution to individuals and businesses seeking affordable, high-quality health insurance. In terms of affordability, as Robert said, 30% less than the typical silver plan on the exchange for an average 40-year-old in Northeast Wisconsin. In terms of quality, no network restrictions. So at a time when politicians in Washington are meeting behind closed doors about the future of healthcare, we're having a public conversation about our needs as Wisconsinites. As private insurers raise rates and lose interest in participating in the Affordable Care Act, we're offering a common sense, affordable, high-quality solution. And that is a BadgerCare option for all. BadgerCare for individuals, the self-employed, and small businesses. BadgerCare for all who need it. Under our plan, BadgerCare would be treated like any other insurance plan available on the federal exchange for individuals and small businesses. but it would be more affordable and more comprehensive than most other plans. And it would be able to hold down the cost of prescription drugs that continue to skyrocket. So as Governor Walker, Senator Johnson, and our Congressman Gallagher consider the finer points of healthcare discrimination, we reject that way of thinking, and we reject that way of governing. We all have a pre-existing condition, and it's the human one. We're all blessed and afflicted in the same way, and we're all in this together. The failure to recognize that common bond is what has doomed the Republican effort to offer a viable alternative to the Affordable Care Act. Now, I want to be clear that the Affordable Care Act should be and can be much more affordable. But we can't achieve that goal in a humane way if we turn over the reins to those who have denied coverage to our fellow citizens, our friends, and our neighbors. We must grab the reins ourselves as elected officials and citizens, patients, and doctors. So that's why I'm here, along with the bill's citizen and legislative supporters, to announce this legislation. But this press conference does not mark the end of this effort. It's my hope that BadgerCare for All and solutions like it will be debated and discussed in these halls and around the country. Similar ideas have been suggested in Minnesota and also in the Nevada legislature. So it's my hope that our gubernatorial and senatorial candidates on both sides of the aisle will be asked to take a stand on this question. Because the stakes are too high, the consequences too immense for us to leave this decision to a few lobbyists and politicians in Washington. So thanks for joining us today. I'll now turn things over to one of our co-authors, Senator Dave Hansen.
Good afternoon. Thanks for coming out on this beautiful, beautiful summer day. A lot nicer in here than outside. But it's great to see so many people here. And a lot is being said today about the changes coming under the GOP plan, about the millions who will lose their health insurance, and about how it will be much more expensive for those who are older or sick. And I just pulled some numbers off this morning. Under Trump Care, or Ryan Care, or whatever you want to call it, the average consumer's insurance premiums would go up 74%, and at age 55 to 64, premiums would increase, just the premiums, 115%. So it's so important for us to be talking about what we're talking about today. And then besides that, you hear on Trump Care, $800 billion tax cut to medical assistants, a $600 billion cut to the wealthiest, and a total of $1 trillion total tax cut. To me, that means we got to do what we got to do in this state, and that is provide this option, BadgerCare. So a lot has been said about the increasing costs for middle-class families. We believe that every resident of our state deserves to have affordable, quality, and accessible health care regardless of their income, and that is possible to achieve that goal. It can happen. That's why I'm happy to be here with Representative Genrich. He explained it so well. And to talk about his plan, BadgerCare for All. BadgerCare for All. No matter who you are or how much money you make, under this plan, you would have the option to buy into BadgerCare, the state's bipartisan plan that is popular, successful, and cost-effective. It works because the state can use its buying power to negotiate lower drug prices, and we know how that is in our country and in our state, and services. This means lower out-of-pocket costs and lower premiums. BadgerCare already covers hundreds of thousands of people across our state, so it's tested and we know it works. It's time to come to Wisconsin and get this done and to provide that option. Thank you.
Welcome up, Representative David Crawley. Let me say one quick thing, and that is you may be asking with Medicaid, what if they go to this per capita cap and they cut it 25 to 35%, say in the Senate? This doesn't have any effect on that because the person pays or the tax credit pays. And so even though we were very much opposed to draconian cuts in Medicaid, this program can go forward either way, even under the Republican bills. So Representative Crawley, thank you very much for joining us.
Thank you. Thank you for everybody for being here to help us introduce this important legislation. In recent years, the city of Milwaukee has been accomplished, the accomplished city to see the most signups under the Affordable Care Act. Because of the Affordable Care Act, thousands of people now have access to health coverage that previously were under are uninsured. BadgerCare for All would build upon the progress, even though it's not perfect, the progress that we have made under the Affordable Care Act, and improve the quality and affordability of the insurance available to Wisconsin citizens. Creating this public option will give many residents access to more healthcare options, not only in Milwaukee, but for all of Wisconsin, including our northern brothers and sisters who have no options. BadgerCare for All will provide the necessary healthcare access in these communities where coverage is not offered. As elected officials, we have the ability and therefore the responsibility to ensure a basic level of healthcare security for Wisconsin families, but also for entrepreneurs. That is why I'm proud to stand here today with my colleagues to support this bill, and thank you all for being here.
I now want to welcome up Senator Chris Larson from Milwaukee area to talk about the bill. Thank you very much.
Thank you, Robert. Thank you all for being here. Thank you to Citizen Action, as well as the bill's authors, Representative Genrich and Senator Hansen, for introducing such a piece of needed and common sense legislation. As national Republicans like Senator Johnson and President Trump are seeking to shoulder people out of their health care in favor of offering huge tax cuts to the richest among us, the people who don't need them, I think it's inherent upon us to look at what we can do as Wisconsinites, as leaders, to do something that reflects on our values, to make sure that people are viewed as neighbors instead of dollar signs, so that we are doing something common sense that is able to offer them health care in a program that is already successful, already seen as a national model, and can very easily pick up folks who are going to be cast aside if Trump and the national Republicans are able to get their way in moving forward with their wealth care bill. This is part of Wisconsin values, where we look at each other, we look out for our neighbors, where we innovate and we do what's best for everybody. And it saves dollars. For instance, when Walker decided to play politics with the health of our neighbors, as everybody knows, by rejecting the opportunity to strengthen BadgerCare these last few years, he refused to take the Medicaid expansion. It resulted in less of our neighbors having access to affordable coverage, but his scheme is also projected to cost us $678.6 million by the end of this year. To make matters worse, in both the House and Senate bills, non-expansion states like Wisconsin stand to lose billions of our dollars to other states, and that continues to project into the future. So I think it's upon us to do what's smart, to do what's common sense, and to move forward with this piece of legislation in a program that has had broad bipartisan support. We hope that folks will view this through the lens of what's best for Wisconsin, what's best for everybody, and not just best for one party over the other.
I also want to acknowledge Representative Reber is here with us today, Representative Brostoff is here with us today, and Representative Anderson are here with us today as well. And before we open to questions, let me just conclude that in this whole debate in Washington and the non-debate here in Madison, because healthcare isn't even coming up really this session in a significant way, there's this assumption that somehow there's some kind of market solution where if we jigger with this, that everyone will be able to get healthcare no matter what, that healthcare will be a right. When the fact of the matter is that the only actors in the system that care whether everyone can get healthcare no matter what are we the people. That is us, our elected government. And we are here in the Capitol Dome. This government could make a huge step if the politicians in this building who actually talk about premiums and co-pays being too high, deductibles being too high, cared about this for real and not just politicking, they would do this right away. This is a simple bill with no fiscal impact whatsoever. And by the way, no one would be forced to go into BadgerCare. They could choose to pay 30% more for private, narrow network health insurance, wherever they are in the state. And so it'd be up to the people, and they'd have a choice. And so this makes imminent sense, and the fact that it's not, we'll see what happens with this bill, but if this is not scheduled for hearings, if this doesn't get scheduled for a vote, it'll be further evidence that the majority party here wants the healthcare system collapse for political reasons and doesn't believe any of their protestations that they want to make healthcare affordable, available to everyone. But if they wanted to work in a bipartisan way, you heard it today, everyone here would like to work across the aisle and do something that makes sense for people, and this would be a great start to move forward towards a system where everyone in Wisconsin had health care no matter what. And so with that, we can open it up for any questions that the Fourth Estate may have.
Thank you for sponsoring this bill. I just have one question, and that is, does the bill prohibit employers from purchasing, like small employers who struggle to purchase healthcare for their employees? Does it allow them to also go to BadgerCare?
It would, yeah. Small businesses are currently on the small business market, the exchange, eligible for that. They would be eligible to purchase BadgerCare under the bill.
And as you know, about 1/3 of small businesses in Wisconsin can afford health insurance right now, and the major reason they can is cost. So it's a huge impact for small business. Yeah, go ahead.
A question for Representative Gingrich. Would you say that repeal and replace efforts in Congress have emboldened Democrats who want to see a public option or even a single payer system?
Yeah, I mean, just speaking personally, it certainly motivated me as a member of the Democratic Party to step forward and offer compelling solutions. Because as Robert said, going up through the campaign and beyond, Republicans, I think, offered some fairly cogent critiques of the affordability issues and some of the access issues that are ongoing in this country. But the solutions that they provided are completely inadequate and run counter to those problems. So what we've decided to do is step into that void and to offer, what we think is a compelling solution to some of those issues.
Let's start with media, and then we can go to citizens. Any other reporters?
How many people do you expect would buy into coverage and costs?
That's a super good question. I think the LFB didn't know, basically.
Yeah, they didn't provide any sort of an estimate as far as who would buy in at cost. Under the bill, we're also seeking waivers to allow for subsidy supports for those tax credits that Robert talked about for people who are purchasing insurance on the marketplace.
We believe anecdotally that paying 30% less and having basically a very broad network would be appealing, but you're right. There are other states that propose this. Nevada passed it in their legislature, but got beat up by the governor. Governor Dayton in Minnesota is trying to do it, but we would be one of the first. But as I say, there's really no harm if no one wants to buy this. It's not going to cost the state
Do you believe
any
a
additional money.
significant portion of the 225,000 people on the exchange would probably shift to BadgerCare if they had that option?
Yeah, I mean, you'd think there would be a sizable number of people who would choose it, yeah. That's our hope.
So any other reporters in the room that have a question? Otherwise, we can open it up to citizens. Okay. Yeah.
I have one further question. As a physician, it's a challenge to accept Medicaid, BadgerCare clients because the reimbursement is low, as by design, because we're trying to rein in healthcare. Would there be negotiating if large numbers of people bought into this, which I view as a grassroots way toward a single payer, which is great, but would there be negotiation possibility to raise some of those, payments?
Let me respond quickly. That's entirely within the legislator's purview to set the rate, so they could adjust them. And what's driven BadgerCare without opposition from the medical community all along is that it's better for them for someone to have a source of insurance than to be uninsured.
Okay.
And so there's that to figure. But absolutely, the legislature can adjust the rates accordingly.
Right, and we've called for accepting those federal investments in Medicaid for some time now. Representative Reamer has been a huge advocate of that. If we were to accept those dollars, obviously we can put those to use to improve reimbursement rates across Medicaid.
Thank you.
Yes, sir.
Have you explored whether there's any Republican interest in joining with you?
Yeah, so we did circulate the legislation to all legislators regardless of party. We have yet to find a Republican co-sponsor, but as I said, this is the beginning of the conversation. It's not the end, so we're going to continue talking.
And obviously, constituents have a bigger impact than politics. So if constituents talk to them, they're interested in anything constituents are talking to them about.
If you don't see your representative up here, give them a call.
Yeah. A concern that I have is $2,000 a year is still a lot of money, and there's still this dichotomy where public sector employees pay virtually nothing for health insurance, but many residents of the state aren't that fortunate. And what can be done to achieve more equity in that? I mean, if it's possible to give state employees who were a very large pooled and attractive package. Why isn't it possible to extend that to every resident of the state?
Well, they pay what, about 14%, is that the number, or am I confusing that with the pension? Yeah, right, so they're paying now, but obviously, I mean, my reaction, maybe it says have different reactions, is that's why the tax credit system on the Affordable Care Act makes sense, because it's based on income and cost of insurance to you, and in fact, we don't think it was generous enough, and that was one of the well-grounded critiques Representative Genrich was talking about. And so you could also deal with that with BadgerCare, because if the waiver's approved, which it should be, then those tax credits would apply to BadgerCare as well. So I think that would be the most equitable, to use the progressive tax credit system. I don't know if anyone else has a thought on that. Okay. Yes?
So you talked about the expansive networks that BadgerCare has. Is there any data on the capacity of those networks to absorb what may be a flood of new enrollees?
Yeah, I mean, that's not something that we've explored to this point, but, you know, as I said previously, you know, we're at the start of this, so as we continue to vet the legislation, you know, we'll have more thorough fiscal estimates that will come through, and that hopefully will be a part of the discussion.
And I would say there was an increase roughly in 5 percentage points under the Affordable Care Act of people insured in Wisconsin, and no reports of the capacity issue. We think this is a great bill. We're not claiming it'll get us to 100%. It's a step in that direction. So I would say that the new enrollees is going to be less for this than you had with the Affordable Care Act. Most likely. Though if it gets to 100, we're all think it's great. So don't get me wrong. Any other questions? Okay, well, I think this is about doing what we've done in Wisconsin for decades, that is, and up until recently, and that is making government work. This is a really simple, common sense solution that there should be no objection to whatsoever. It could reduce people's premiums and deductibles by 30%. So the stunning thing is that there haven't been any sign-ons yet, and I think that has to do with constituents talking to their legislators. So thank you very much, everyone.
Thank you so much.